Now we're going to talk a little bit about some disorders of olfaction because there are things that you may have experienced yourself and which can have some significant clinical implications for people in their lives. So the word anosmia means a lack of the sense of smell. A similar term is hyposmia, so HYPO, which means a decreased sense of smell. And then there's another one which is parosmia, where you're sensing something that's not actually what you're sensing in terms of smell. So in terms of anosmia, there is such thing as congenital anosmia, people who are born without the ability to smell. Interestingly, sometimes they have no olfactory tract or they have no olfactory bulb. So something in the genetic code is missing and they are missing a piece of the puzzle, and so they cannot smell at all, ever. It's very rare. What's more common is to have an acquired loss of your sense of smell, and there are lots of potential causes here. One of the biggest ones is age. Now, it turns out, remember that cribriform plate that the axons from the olfactory receptor neurons went up through to reach the olfactory bulb? Well, they kind of narrow and calcify over time, which then just squeezes or pinches off the olfactory receptor neuron axons entirely. So, loss of smell as we age is a kind of normal phenomenon, which might be why if you go visit your grandparents or something, if they like to wear perfume or cologne, you might be a little overwhelmed with how much they put on. And that's because they have a reduced sense of smell compared to younger people. There's also some data that there might be some brain changes involved in that age-related loss of sense of smell as well. But I thought it was a nice opportunity to remind us of that cribriform plate. The other thing that can happen, especially in older individuals, is both Parkinson's and Alzheimer's disease are associated with loss of sense of smell. Interestingly, it may precede or come before the other symptoms of the disease. So in Parkinson's, other symptoms would be a tremor or difficulty with motor movements. Alzheimer's disease, you probably know, would be trouble with memory, right, and development of dementia. Now, so some people are excited because they say, well, hey, if this is an early sign, maybe can we diagnose it earlier? Might there be opportunities for interventions that could be helpful? Which is all exciting, but we also have to remember that it's also normal to lose your sense of smell as you age. So how we would distinguish between typical age-related smell loss and potential incipient or new onset Parkinson's or Alzheimer's, that would be the tricky bit there. Head trauma is also a cause. So one of your media assignments is to watch a video about a young woman who was actually struck by a car and resulted in anosmia for her because those little axons, as they come through the cribriform plate and then they synapse with the mitral cells in the olfactory bulb. As you can imagine, if you have some significant head trauma, that could be fairly easily disrupted. So head trauma is not an uncommon cause of lack of sense of smell. And then infections. So anything that causes congestion in the nasal mucosa and makes everything kind of swollen and lots of thick mucus, and it's harder for the odor molecules to dissolve and penetrate down to those cilia on the olfactory receptor neurons. So anything that causes a stuffy nose by making it harder for the odor molecules to reach those cilia, or by making it so that you're just not even able to breathe in and out through your nose, right? So there's no air movement coming in. All of those things can decrease your sense of smell. But there are also some infections that can damage the olfactory epithelium directly themselves. And so one of the now famous causes of that would be COVID-19. So the COVID-19 infection, which is caused by the there's a typo there, SARS-CoV-2 virus, actually directly infects the supporting cells. So if we remember our olfactory epithelium, we have the ORNs, the receptor neurons. We have the supporting cells, which support and nourish and protect the ORNs. And then we have those basal cells, which will serve as new ORNs when we need it. So this is a diagram that kind of shows you, in the orange here are the little viral particles of the SARS-CoV-2 virus, and they are infecting the sustinacular cells, which are the supporting cells, which are these kind of blue ones here that are located in between the bipolar olfactory receptor neurons, which are shown in purple. So what's the reason why SARS infects these cells is that they express ACE2 receptors. That is one of the things that the virus can glom onto to then invade the cell. The olfactory receptor neurons themselves don't have a lot of ACE2 receptors, so when they do studies and they look, although sometimes the ORNs get directly infected by the COVID virus, it's relatively rare, but the sustinacular cells really do. The supporting cells really do. And so they get wiped out. So in animal models, like they get completely eliminated within a couple of days of a nasty COVID infection. And without those supporting cells, the ORNs actually die off. So first they don't function well, and then eventually, as we're still waiting for those sustinacular cells or those supporting cells to regenerate, the ORNs die off without their help and support. So this is what that looks like. So again, we've got the sustinacular supporting cells that are infected, right? And then the olfactory receptor neurons are getting all disrupted and not able to function appropriately. We also can see here some cells of the immune system, which are shown in green, are coming in to deal with the infection, but then of course they're also creating inflammation at the same time. Interestingly, the supporting cells can recover in about 2 to 3 weeks. So many people who had COVID-19 infection lost their sense of smell or had a decrease or alteration in their sense of smell, but it came back after a few weeks. Now, that is because the supporting cells come back, and so the olfactory receptor neurons, if they had survived, are now able to function normally. But in some folks, if the ORNs got wiped out too, then it can take a lot longer, or maybe it will never occur. Maybe the ORNs can never recover. So obviously it must also affect those basal cells. Interesting. So here is an example of what's happening after the infection is done. So in some people with persistent symptoms, you're making antibodies, which is good. So now you're protected against COVID, but you may have some persistent inflammation. You may have an inability to regenerate those damaged tissues. So that's what they're showing here in this diagram. Now, what's interesting too about this is if you lose these receptors, you lose the ability to sense things, what we find is in the absence of these signals coming in, your central pathways change, your brain changes as well. This is a diagram that shows that. There's a lot going on here, but it was also a nice opportunity to remind ourselves of all the different places that olfactory sense goes in the brain. So up here, they're showing you healthy epithelium. We've got our ORNs in yellow and our support cells in pink down here. Axons traveling through the cribriform plate, and then they're going to synapse with the mitral cells, which are the neurons in the olfactory bulb, and then they're going to send their axons through the olfactory tract. In infected epithelium, right, the ORNs are unsupported because the supporting cells have been wiped out, and so they start to degrade and not function well. And then what can happen then is that in the absence of signals coming in, we see some actual degradation of the axons in the olfactory tract as well. Kind of a use it or lose it thing, right? Which is something that happens all the time in our bodies. So what they're showing you here is that there is data showing that in folks who have lost smell due to COVID, where it's been permanent, they have loss of gray matter. So we see gray matter reduction, so loss of actual neurons in different parts of their brain, including that orbitofrontal cortex, right, which we can see on both sides here, which we talked about is where we are consciously aware of and identify different odors. The amygdala here, which is for emotions, the hippocampus here, which is for memories, right? So they've got those listed down here too, and some other areas that we didn't talk about directly. So Is this important beyond the fact that you've lost this ability to process olfactory information which wasn't coming in anyway? Or does this have additional implications for your brain function in general? So that's kind of the question is, do you need that olfactory sense coming in, helping, signaling, activating these different brain regions in order for them to function optimally for all of the different things that they do? Or if you lose your sense of smell and you lose that type of input and you lose those specific neurons, no big deal, everything else still works fine? Good question. What we do know is that people who lose their sense of smell or never had it to begin with, which is rare but can happen, or have a decreased sense of smell, they are at increased risk of certain things, right? So they cannot smell smoke. So if they left a pan on the stove and now it's starting to burn and maybe their kitchen's going to catch on fire and they're in the other room, they will not smell it. They will not know. They can't smell natural gas or spoiled milk or spoiled meats, all those types of things. So people without a sense of smell will often get food poisoning because they'll eat food that's gone bad without realizing it. Food is also less appetizing if you can't smell it. So in the last part of the lecture, we'll talk about flavor and how we perceive the flavor of foods. And so without your sense of smell, food is a lot less appetizing. And so that often leads to weight loss and even malnutrition in a lot of people. Now, certainly a lot of Americans currently could stand to lose weight, but in a lot of older people, maintaining your nutritional status can be a struggle. So this can make things really challenging. We also know that in people who lose their sense of smell or even who don't have it to begin with, they have higher rates of depression and anxiety. So is that because of the lack of all those social cues or the sense of emotional bonding that we get from smelling the people that we love, who we are around? Or is that due to not having certain neurons in those areas of the brain, right? So we don't know. But so losing your sense of smell is actually associated with some significant negative outcomes. So in summary, there's lots of potential causes of olfactory disorders, but aging is very common, head trauma is not uncommon, dementia is common, and viral infections with COVID-19, of course, being quite an example. So COVID-19 infects the supporting cells, so showing us how crucial they are, because when they die off, the ORNs themselves can't function properly and may also die off as well, perhaps never to recover in some people. And losing smell results in exposure to potential hazards. You can't identify things, certainly loss of enjoyment of foods and other things with the potential attendant weight loss, and higher rates of depression and anxiety. And we saw that loss of gray matter in several different areas of the brain that normally receive olfactory input. So it's significant. All right, so our last section of this lecture will be on taste. See you there.